Social prescribing is an innovative way of referring people into local non-clinical services. National statistics show that 1 in 4 people visit their GP with problems that can't be fixed by medical or clinical needs. Our social prescribing link workers refer people into services that can help. It might be related to housing, it could be related to finances, isolation or loneliness. All these things that can seriously impact on a person's health and well-being.
Social prescribers are people who listen and who support people in the community to find out what matters most to them. It's about linking people in with community groups, with social organisations, with support groups that can help people to progress in their well-being.
Once we get a referral from the GP or from the professional organizations, we contact the person. We contact the person and then we have to find out about them. We will have to understand somebody's life circumstances, and by doing so is making them the center. It's what matters to me. That is the motto for the social prescribers. We ensure that we understand and we listen from the individuals. Sometimes we can get a referral for one thing from the GP or from the other professionals, but by listening to them, we then explore and find out that they need to be supported in other areas.
The social prescribing team at Brighter Futures last year supported over 1,500 patients. Social prescribing is about working with people in the community who need the support, who need the help, and working alongside them to help any matters that they have which can help to improve their well-being. Social prescribing is critical because it helps to reduce the level of pressure on the NHS, and it's also an excellent opportunity for us as social prescribers and for patients and for the NHS to work together and support people.
Brighter Futures social prescribing team have been working in 7 primary care networks since March 2020. The areas that we currently cover are Stoke-on-Trent, Newcastle-under-Lyme and the Staffordshire Moorlands. The pandemic has meant we've had to change our approach before we even started, but the last 2 years have seen us have the privilege of working in so many diverse backgrounds with so many diverse people and help change their lives in so many different ways. It's been a challenging but amazing journey so far. Our aim is to meet the challenging demands of our region and continue to make a difference in people's lives.
As a social prescriber, the best thing about it is when you're supporting an individual and they achieve their goals. I'll give you an example. I've had to support somebody who was smoking, and I referred them to quit smoking, Stoke-on-Trent quit smoking. When we do referrals, we have to call them back to get an update. We don't just refer them and leave it there. We call them back to ensure that they have received the support that they required. So I called somebody who I was supporting to quit smoking, and the answer was very, very moving, I could say. And they said, "It is good to meet people like you, social prescribers, because without you, I couldn't have achieved my goals." And he said he had quitted smoking. 2 days ago, he hasn't been smoking. And for us, that is an achievement. It is about the individual. During the epidemic, a lot of the referrals we've been doing is loneliness. So we've been supporting for Befriendly services, we've been supporting bereavement services, and when you call back to get an update, the best thing is they will say, "I am so comfortable now and I've got somebody I can speak to because I've got a friend that can phone me."